gonna shut the door, pull the curtain. Hello Jane, my name is Missy and I'm gonna be your nurse today. I'm gonna set my stuff down here. How are you feeling? Feeling good? All right. Well, I am gonna first start off with doing your central line dressing change, your IV site. It's time to be changed. 7 days we change it out. So first of all, I'll have your name and date of birth. All right, yes, that looks correct, your ID badge. And also allergies, do you have any allergies? All right, great. Well, just gonna explain the steps. So basically, when I complete this, I will have you either wear a mask or you can turn your head to the side. What do you prefer doing, Jane? Wearing a mask? Okay, I'll give that to you here in a second. And so basically, I am going to assess the site, take off the old dressing, and then put a new one on. Any questions before I get started? No? All right. Well, I am going to help you with your mask here. And I am going to make sure my field is clean here. No sharps. And I'm going to wash my hands here again. I'm going to put on some gloves here. Clean gloves. And next I am going to assess the site and palpate. Are you having any pain, Jane, or any discomfort? No? All right. Well, that's good. And the line says 52. So that's good. So I am going to take this off. So I'm just going to use some alcohol, pulling around the bottom here, and pull towards the insertion site. All right, then I'm going to throw that in the garbage. And I'm going to assess the site here again. I'm checking for any redness, any swelling. The skin looks good, intact, not red, no drainage noted. That looks good. And then if there was an antimicrobial patch, I would have removed that. I'm going to assess the hub and the catheter, and that looks good as well. And so yeah, so that's that. We'll wash my hands here again before we get started. Gonna open up my kit, put that aside. Before we get started, I forgot to raise the bed and lower the head and put the side rail down. Open this up nice and carefully. Reaching up the tip of that. And then next I'm going to put on my sterile mask over my imaginary first mask. Step away from the field so I don't get anything contaminated. And then I am going to take out my sterile gloves by pinching it as best I can. We'll put that I'm going to pinch here. Trying to not touch the rest of the glove. And I use my fake gloves here. And I am going to now, let's see, I'm going to take these off, but just pretend I have them on, the sterile gloves. They're just kind of in my way. But I have gloves, sterile gloves on. And grab my, since my other hand is sterile, both hands, open it up. And I am going to hold on to the catheter here. I am then going to grab my alcohol, and then I am going to start near the insertion site and scrub or go in circular motions, get the line, get underneath, and that can go in the garbage. And then I'm going to squeeze and dip, and then I'm going to start at the insertion site and scrub around that, circular motion, back and forth on the hub and underneath. Put that in the garbage. And then I am going to let this go. That'll be in the garbage. And then I am going to, since my hands are still sterile, I'll grab my Tegaderm and going to go ahead and angle it and put it on. All right, now I can imaginary date this and initial it in time. All right, and the hub still looks good. If there was if the facility does antimicrobial patch, I would have put one there, and also if there was attachment, I would have had put that on as well. And then I would change out the lock as well. All right, Jane, great job. Do you need anything else? All right, I'll take off your mask. You can put your head back or comfortable. I'm going to lower the bed, put up the rail, and put up the head here, and give your nurse call light button.